We are going to do an instructional video for the axillary shoulder. This is a final only exam, and Mrs. Marshall is going to be my patient and shoulder model. And we're going to go ahead and get started. You're going to put your SID at 40 for this. You can't see it, but trust me, it's at 40. And then you're going to use a 10 by 12. And you're going to have the red line at the bottom, and you're going to put it in here portrait, not like this. You're going to put it like this. Okay, so basically we're going to do her left shoulder. So I'm going to have her take her left arm, and she's going to get her elbow out here as far as she can. This is usually a pretty painful projection for the patients when their shoulders hurt. So you want to get as much set up as you can and try to be as quick and efficient as possible. So there is a 5 to 15 degree angle for this projection. Kind of just depends on how far out they can move their shoulder. If they can't move it out very far, obviously you need more of an angle. I normally do anywhere from about 5 to 10 degrees. And we're going to pretend that her shoulder really hurts. So we're going to do a 10. Now you want to put their elbow at a 90-degree angle, just like this. And then you're trying to get this joint here, so you really kind of have to push the IR into their ribs. It's not, like I said, a very comfortable position. And you're going to try to bring their shoulder out. Now their elbow ideally should be off of the cassette and on the table. That's what we want. Not everyone is able to do that. And then normally I just kind of make sure that they're not rotated too far forward or rotated too far back. You want to make sure that they're nice and straight. And this is your left. Now, you don't want to get their head in the picture, so it's very important that you kind of have them look down and kind of tilt their head away, because if you get their head in the picture, then you are going to have to retake it. Okay, and you basically center right on top of the shoulder, right at the top of the humerus is where you want to center. And you can collimate in just so that you have a light shadow of the humerus. I'm going to put my marker back here on the lateral side. I'm working the left shoulder. And I'm going to give my patient one last push out, move her head down, make sure she's straight. And then I'm going to expose this at 70 kVp. And that is the axillary shoulder projection.